Welcome to Loma Linda University Medical Center's Proton Treatment Center. Loma Linda University Medical Center, located in Southern California, is a world-renowned teaching hospital. For more than 100 years, Loma Linda University Medical Center has been a leader in medical advances. It was here at Loma Linda that the world's first hospital-based proton treatment facility was created, and where pioneering work in proton therapy continues today.
My father's vision was to try and cut down the side effects that he was seeing from using conventional radiation early on. He had a background in physics and felt that proton therapy, because you could control it more precisely, would really be the best tool to use for radiation therapy treatment.
As with any medical treatment, expert and experienced caregivers are an advantage for the patient. More than 17,000 patients have been treated with protons at Loma Linda, which is more than any other proton treatment center in the world. In fact, our physicians have more than 170 years of combined clinical proton therapy experience. Selecting a treatment for cancer is a very personal decision and is one of the most important you will ever face. You will need to answer difficult questions, such as what types of treatment are available? Is proton therapy right for me? What are the advantages of proton therapy? And where should I go for treatment? This video will guide you through these and other questions you may have. 3 basic categories of cancer treatments are available today: surgery, radiation, and chemotherapy. Depending on your situation, you may use one or a combination of these treatments to fight cancer. So, what is proton therapy? Proton therapy is a type of radiation treatment. Proton therapy uses an external beam of radiation to kill cancerous cells. Traditional forms of radiation, such as X-rays, which are used in IMRT treatment, can destroy many types of cancers when given at high enough doses. However, these traditional types of radiation are difficult to control. Because of this, much of their energy is spent entering the body. Radiation is deposited in normal tissue that surrounds the targeted tumor and passes beyond the tumor through the body. This lack of precision causes radiation to damage healthy tissues, sometimes so much so that an adequate dose cannot be delivered to the tumor. Only protons can be controlled to deliver maximum energy at the tumor site. Very little radiation is wasted entering the body, and the precision of protons prevents radiation from continuing beyond the tumor site. This level of control is unique to proton therapy and makes it superior to other forms, such as IMRT, gamma knife, and tomotherapy. Proton therapy is also referred to as a type of conformal radiation therapy. Conformal means the beam can be shaped to match the targeted tumor. This enables the entire tumor to be treated, but spares surrounding tissue.
Well, the major difficulty we have in cancer management is destroying the normal tissues around the cancer. So with proton, since we don't hit the normal tissues nearly as much as other forms of radiation, we have a better chance of control and also a better chance of being without side effects.
Proton therapy is most effective on cancers that are confined to a solid tumor that has not spread or metastasized to other parts of the body. Prostate cancer is an excellent example of this form of cancer. But other areas of the body can also be treated effectively with proton therapy. These include conditions of the brain and spinal cord, including isolated brain metastases and non-cancerous conditions such as arteriovenous malformations. Cancers affecting the base of the skull, eye, and head and neck, inoperable small cell lung cancers, as well as liver and certain gastrointestinal cancers are treatable with protons. Loma Linda has also pioneered proton therapy for pediatric tumors and certain types of breast cancer. Our published results have shown excellent outcomes. These are just some of the most common types of cancers we treat, but the physicians at the Loma Linda University Medical Center Proton Treatment Center can treat and have treated more types of cancer than any other proton facility in the world. Proton therapy has many advantages. Proton therapy is more accurate than other forms of radiation. Proton therapy is non-invasive. No incision or cut is made to remove the cancer. Because of this, proton therapy is an outpatient procedure. Proton treatments are painless. The patient feels nothing during the procedure and can leave immediately following treatment. And because of proton therapy's accuracy, many of the side effects of radiation treatment can be significantly reduced with proton therapy.
When I checked the Loma Linda website on Proton, I liked everything I read in the testimonials about the no side effects. I thought the no side effects was pretty special.
I didn't have to worry about my chest being completely sunburned or the sickness of chemotherapy, of losing my hair. That's a biggie.
It is pain-free. You don't feel anything. You hear the machine working, but other than that, it's rather a cozy time.
The treatment just takes a matter of a minute. They don't feel anything with it, and then they're essentially free after that to do most of the time whatever they'd like to do. Whether it's going to the mountains, the beach, and a lot of them golfing, and create friendships and do things together.
Precision is the key to success in proton treatment. It is maintained through the entire process of proton therapy. That precision begins with careful planning and preparation. Prior to treatment, a three-dimensional reconstruction of the tumor is created using computerized radiographic technology, such as computed tomography, usually called CT scans. Other forms of scanning technology, such as MRI and PET, may also be used in treatment planning. Next, the members of the treatment team develop a patient-specific treatment plan using computers to outline a series of proton beams entering at various angles. From these, they calculate the radiation dose being given to the tumor and the normal tissues. Finally, the physician reviews and approves the treatment plan. That information is then transferred electronically to a series of automatic machines that create patient-specific devices required by the plan. For example, each patient has an aperture that is designed to form and shape the beam to the exact dimensions of the patient's tumor. By shaping the beam to match the tumor, less damage is done to healthy surrounding tissue. From beginning to end, each patient's treatment is unlike any other. Proton therapy begins by moving the patient into the precise position indicated in the treatment plan. The proton beam is then directed at the patient's tumor, and protons are released in a series of pulses that can't be seen or felt. After the prescribed radiation dose has been delivered, the computer shuts off the beam. The actual delivery of radiation lasts only a few minutes. The entire session, from beginning to end, usually lasts no more than 30 minutes. The patient can immediately return to normal daily activity.
Proton treatment was so easy because I did it during lunch. It took 30 to 45 minutes. I went back to work and it was all done. 2 hours later, I've forgotten that I had a doctor's appointment or I had proton treatment.
It was quick, comfortable. I came in from work, had my treatment done, and was back at work within about 30 minutes.
It's easy. You don't feel anything, neither during nor before nor after the treatment, and I have no side effects.
Most patients may return for treatment 5 days a week for several weeks. The reason for this is that healthy cells and cancerous cells respond very differently to radiation. Healthy cells recover better in between doses, so smaller doses are given over a longer period to allow normal cells to recover, while the cumulative effect of the radiation kills the cancer cells. Our guest services team can provide you with referrals for temporary housing or patient-preferred hotel accommodations. Activities and support groups are organized to allow patients to socialize and share their experiences. Social workers, nutritionists, and other health educators can provide you with information and resources to complement your proton therapy.
The orientation group had such a wealth of information, because I find that here they're not just wanting to treat you with the proton, they also want to treat the whole body.
While at Loma Linda, guests will have access to many of the campus facilities. One such facility is the Drayson Center, a complete recreation center with tennis courts, swimming pools, and other amenities available to our guests.
We can play golf during the morning, and after the treatment we can stay all the morning and no tired, no problem, which is for me really strange. I can't believe.
We thought it was going to be somewhat of a drudgery being away from home, but as it turns out, it's been down to a vacation.
Loma Linda is a small, charming community with housing, shopping, restaurants, places of worship, and other businesses conveniently located near the medical center. Loma Linda's central location within Southern California provides access to beaches, mountains, and deserts, all within a car ride. Sightseeing, a trip to an amusement park, or golf in Palm Springs are all within reach. Proton therapy at Loma Linda University Medical Center is an ideal treatment option for many who suffer from cancer and other conditions. As the pioneer in the hospital-based use of this treatment, Loma Linda University Medical Center has the expertise needed to deliver good results. No other facility has treated more patients with protons than Loma Linda. Because of its extreme precision, proton therapy can effectively control many forms of cancer and, at the same time, enable patients to maintain their active lifestyles during and after treatment.
I would recommend Proton at Loma Linda to any person who's in that position because, first of all, they have the longest experience, and also because they have a sort of a global approach to a person who has cancer.
It was 10 treatments, no side effects. I had wonderful treatment at Loma Linda, and I'm here. After 7 years, I'm still here.
Their whole demeanor is just so kind. And everybody tells me this. Like, can you believe how nice everyone is?
You know, other people can build proton systems based on what's been developed here, but they can't replace the atmosphere, the attitude of the people.
We live in Texas, and we had alternatives in Texas. I could have driven to a proton facility within 30 minutes of my home. I chose not to do that.
Becoming a patient at Loma Linda University's Proton Treatment Center starts with a call to our patient referral office at 1-800-PROTONS. You or your physician should prepare to share your current medical information and treatment history. Our team will carefully review your case and determine if you are a suitable candidate. Within 1 to 2 business days, one of our care managers will notify you of your eligibility and make further arrangements for your treatment. Your care manager will assist you with all steps of the process throughout treatment and will be your primary contact. Our patient business office will also work with you and your insurance company to make sure that your treatment is covered. Medicare covers proton therapy for most conditions, and most other insurers will cover the treatment on a case-by-case basis. The number to call is 1-800-PROTONS. The first step in the treatment of your cancer is to call today.